On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Daniel Aldrich, Dr. Bob Peters, Dr. Garner Newton, Dr. Jonathan O. Hi again, everyone. I'm Candace Kruger along with Jim Knox. We're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center is one of the top medical centers in all of the Dallas-Fort Worth area.
Exactly right, Candace. From technology, equipment, of course, and of course, doctors like our first best doctor who operates right here out of beautiful Forest Park Medical Center. It's Dr. Dan Aldrich.
Quality of life before a replacement is miserable. The shoulders hurt, you can't sleep. The pain is sharp, dull, burning, and it's always there.
Joint replacement is a very common procedure now in our country, but the most common are knee and hips. A lot of people aren't even aware that shoulder replacement exists. But it is a really great option for people with severely arthritic shoulders. We've come a long way in the last 10 to 20 years with the materials we use. The techniques have been really refined so that people can get a very good result with a shoulder replacement where they can have pretty much full use of the arm again without pain. We
did the right shoulder replacement in 2010, and since I loved the way my right shoulder was doing, and the left shoulder was still giving me a lot of fits, I thought, okay, maybe it's bad enough I can get a replacement on the left one. So in January the 15th, I had the left shoulder replacement.
Belinda was a typical case where she was someone who had gradual deterioration in her shoulder, and she had both shoulders involved with severe arthritis. And she had tried the usual treatments, Advils and Aleve and cortisone injection and physical therapy until the point where she just really was having severe pain all the time. And that was the point where we had to talk about replacement. And we did shoulder replacement on both shoulders. And she's done extremely well and has had a great result and is pain-free and has true unrestricted use of both shoulders at this point.
The new shoulder replacement, Belinda, is a very happy person. Dr. Aldrich is a very good doctor. He's knowledgeable in all he does. The quality of my life is improved by what he's done.
Radiology departments are very commonly in hospitals. The difference here is that this is primarily a surgical hospital, and our primary purpose is to support our OR. And we've got 14 OR suites upstairs. We have both pre and post-operative imaging.
Here at Forest Park, I work more closely with the staff members, kind of the segue between the director and the technologist. I'm here with them daily, supervising what rooms they're in, what exams need to be done, what tech goes to what assignment.
We're a full-service outpatient facility. We have an MRI here that's called a short bore. What that means is it's not as coffin-like for patients. It's more open. We also have a CT scanner here. It's a 64 slice that is capable of doing cardiac as well as any other CT imaging that you might need. And it's also an interventional radiology CT scanner, meaning we can do procedures that normally would have had to been done in another room and then brought to CT for scanning. We can do both on the scanner at the same time. We have an on-site radiologist from RCA that read all our imaging. We have an on-site ultrasound unit, fully capable of doing general ultrasound and vascular, and I also have a staff member that can do both.
Here at Forest Park Medical Center, we work closely with some of the best surgeons in the area. They're definitely top-notch. We do what's best for them, and we make sure that we have all of the equipment necessary, all of the reps that they need to make sure that they get the job done well.
Our surgery suite encompasses 4 C-arms that can be used in a variety of times during the day, and our primary OR tech, who happens to be our lead tech here at this facility, is Stephanie Woodley. And she has not only taken the bull by the horns here at this facility, but she's also trained each of the other staff members that work in OR and has done a phenomenal job in that capacity.
If we're doing spinal fusions, that screw placement is very important, and we need to make sure that those screws go in exactly where they need to be. And imaging has everything to do with that. If our image is wrong, then those screws could be placed incorrectly. So we work very closely with the surgeons to make sure that we have the right image that they need, to make sure that they can place the screws correctly in the spine where they need to be. We're actually imaging during the surgery and assisting the surgeon to make sure that he's guiding his tools into the right, proper anatomy to make sure that he's doing it where he needs to be.
I really firmly believe that we have state-of-the-art equipment here, and I've got a top-notch staff that can really meet any of the referring physicians in the community's needs.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
While I was in Texarkana, I had numerous tests because they had thought that it might be ovarian cancer. And when I went in, Dr. O looked at all my records from years past. He said from everything that he was seeing in my counts, from my blood counts, it really didn't look like I had cancer, but he assured me that if it was cancer, that they would get it all in that one operation. If it wasn't, he told me, he said, we will go in and do a total hysterectomy. You will be going home the next day.
When we say robotic surgery, the robot is just a very fancy, very expensive laparoscopic tool. So it's about a $2 million machine that we use, the surgeons use to assist us with laparoscopic surgery. So truly it's laparoscopic surgery, but it's using a robotic system. So the surgeon is still in complete control of the system.
So when I went in for surgery, it was absolutely very easy in that they made it all so easy for me. They took care of me not feeling so anxiety-ridden.
I've personally been doing robotic surgery since 2008. And for me, it's been a game changer for my patients.
And when I woke up, the first thing they said to me is, Mrs. Wright, you do not have cancer. And at that point, I was so ecstatic.
In the past, for a lot of patients with uterine and cervical cancer, those patients required very large incisions, many weeks to months of recovery time. Nowadays, with robotic surgery, they're able to get out of the hospital usually in less than 24 hours.
By noon the next day, I was packing my things, my belongings, and headed back home to Texarkana. You would have never known that I'd had a major surgery. I was able to get up, sit down, get in and out of a car. I owe a lot of that to Dr. O, his knowledge, his expertise. I just can't say how wonderful it was to experience such a painless operation that I had witnessed 30 years earlier with my mom and sister that was much different.
Did you know that Forest Park Medical Center was voted as one of the top 100 places to work in the Dallas-Fort Worth area? Forest Park Medical Center received this honor for the second year in a row. Patty has a question for Dr. Richard Ha. Can I take fat from one area of my body and put it in my breast?
The answer is that the jury's still out. There's a lot of science that surrounds this, and what we do know is that it may not be completely safe. There is some data that suggests that injecting fat into the breast may increase the risk of cancer development. So for right now, until we have more information, it is not recommended that we inject or harvest fat from one area of the body to inject for the purposes of breast augmentation. So consult your plastic surgeon to have that discussion. It is probably still safer to undergo breast augmentation with conventional breast implants.
Now to an inspirational story that happened right here out of Forest Park Medical Center. We want to introduce you to a 2-year-old girl named Mia who was born deaf.
Well, we are from Bolivia. I came 2.5 years ago. My father and my mother, they started to seeing something strange with my baby girl.
I think the very first time that I noticed, and I was the one that really noticed it, there may be an issue, was when I first held her in Bolivia. She was just a few weeks old. I just noted that she didn't appear to be responding to noise and sounds around.
I was thinking that she was okay, that nothing was wrong. Maybe she's distracting, I don't know. When they told us that she wasn't listening, it was hard because I want she can listen to me or she can listen herself. So sometimes it's frustrating that you talk to the baby or you want to teach her something and you can't because she cannot listen.
Well, we first contacted Dr. Peters in Dallas Hearing Institute. Then we knew that he was the president of the foundation, of Dallas Hearing Foundation. And we talked to him, and they started looking for a device for Mia. And I'm glad that they found the right one. And hopefully, and it got help, that's gonna work good. It's gonna work good.
MED-EL, along with the Dallas Hearing Foundation, we share a commitment to the hearing loss community. And when the Dallas Hearing Foundation approached MED-EL, we thought this was an ideal situation to kind of help out a family. And so we put them into our grant process. And as the patient goes through the grant process, Mia and her family were approved.
Mia was born with profound hearing loss, and that means that hearing aids were not able to give her enough hearing. So the only way she would gain adequate hearing in order to develop speech and language, oral language, would be to have a cochlear implant. So today we placed a surgical implant that is meant to stimulate the hearing nerves that are there but just not working, and it will stimulate those nerves and produce for her a sense of hearing. We test the implant and determine during surgery that she is responding to the implant. We actually do not turn it on for 3 weeks. We want to let her incision heal. So we won't turn it on for 3 weeks. So she's just going to have like any typical ear surgery, have some recovery time and some discomfort. But 3 weeks from now is when we'll bring them back to our office and actually activate the implant.
Wow, for her it's going to be a big difference. From not hearing to hearing is a big change. She was living happy without hearing, and now hearing she's going to be happier. That's why we're here. That's why we're in America, in Dallas, in this big hospital, good hospital, and with the best devices that she can get.
Thank you, Dallas Hearing Center. Thank you, Forest Park Medical Center. Thank you, Dr. Peters. Thank you, Linda, Debbie, all of them.
Now stay tuned. A little bit later on in the show, the inspirational story continues as Mia hears for the first time.
Endometriosis is glandular cells similar to the lining of the uterus that gets where it doesn't belong. It can get on the bowel, the bladder, the uterus, the tubes, the ovaries, in their liver, in their lungs. This is a disease that can get almost anywhere, and it's not a malignancy, it's not cancer, but the symptoms that it produces are so life-interfering that it feels like a life-threatening problem. They can't function. And it grows with hormones. And all of this is related to their immune system. Women are more likely to have lupus, rheumatoid arthritis, hypothyroidism. They have problems with their bladder where they pee a lot during the day and there's blood in the urine. So because of the immune system, this disease continues to grow. They can't eradicate it, they can't get rid of it. And it does grow with their own hormones or even artificial hormones such as birth control pills. How do I know when to go to the doctor? If your symptoms are interfering with your normal functions, that's the time to go see a doctor. If you wake up in the morning with your cycle and it hurts a little bit, you don't even have to take any medication, maybe you don't need to see a doctor. If you have to take any pain medication, if you have to lay on a heating pad, if you can't go and have fun with your friends or your family and do your normal activities, that's the time to seek help from somebody who deals with endometriosis on a daily basis. The way to cure and get rid of as much endometriosis as you can is actually to cut it out. We outline it and then lift the tissue up and then cut underneath so that we have normal tissue that we take out along with the endometriosis. So by doing this, we eradicate as much endometriosis as we possibly can. Any place where this disease is at, we have to excise it / cut it out so that we give that patient the best opportunity to be as symptom or disease-free as we can. The goal of this is to treat this disease early. If we can treat this disease early, we have a much better success rate in eradicating this disease so that a woman can go on and have a very functional life. And early treatment is key to this.
For more information about beautiful Forest Park Medical Center, as well as the outstanding doctors that operate right here out of Forest Park Medical Center, you can head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And now let's check in with our next outstanding doctor that operates right here at Forest Park Medical Center. It's orthopedic surgeon, Dr. Charles Toulson.
I had probably a 3-year extended period of deteriorating knees. They just got to where I had been able to work out and run. Then the pain got to be such that no, you couldn't run anymore. And I could jog, and then it got to where I couldn't jog. At one point, I finally tweaked one of the knees, tore some more cartilage, and then I was looking like the mummy for about 7 months. It was horrible.
There are 3 compartments in the knee. There's the inner knee, there's the outer knee, and there's the compartment behind the kneecap. When patients have arthritis in 1 or 2 areas of the knee, they're candidates for robotic partial knee replacement. Osteoarthritis of the knee is very common. Often patients have activity-related pain, but later it can progress to having pain at rest or pain that even wakes them up from their sleep.
Went to see Dr. Toulson, a very personable guy. He x-rayed both knees and looked at it, and he said, well, I got bad news and worse news. Bad news is it's really true that you did tear some more cartilage in the knee. The worst news is, even if I repair that, both knees have substantial osteoarthritis, and doing the arthroscopy now is really not going to give you the relief that you're seeking.
Steve was a unique case. He was a 64-year-old gentleman with osteoarthritis of both knees. His arthritis was confined to both the inner aspect of both knees. So he was a great candidate for getting bilateral knee replacement using the robotic technology. Steve is incredible. He is back to his active lifestyle. He has no pain, he has no limp, and his incisions are very small. You could hardly see them.
I'd say it's been a grand experience. I will never again take for granted walking without a limp. You just don't realize all the things that you give up when you're walking around in pain and dragging a leg. It's not any fun, and all that's gone. I can get in and out of cars, I can go up and down stairs, I can do pretty much anything I want to do now.
We're groundbreaking for Forest Park Medical Center here in San Antonio. It's a new 54-bed facility here in San Antonio. And I think the outstanding piece of this is just the quality of care that we can bring to San Antonio. For the insured patient here, it's just going to be outstanding. The quality of care that Forest Park offers, as you know, this is the 5th facility that Forest Park will offer. We have a facility in Dallas and Frisco. We're about to open in Southlake. You know, I personally think that it's the quality of care that sets Forest Park apart from our competitors here in San Antonio.
The greatest thing about Forest Park, really, to be honest with y'all, is the people in this room and the people that we touch have an opportunity to secure their own future. And when you travel around the rest of the world and you see how healthcare exists, you kind of have a future, a vision of what's going to happen to us in the United States. There's going to be a healthcare system for the vast majority of people, and those who want something different need to have someplace else to go. And we need to have physicians to treat those people who want to have someplace else to go. And those physicians are in this room. And we have an opportunity to affect very positively on the healthcare for the future and the way we take care of patients. In addition, we also have the opportunity to secure the future of ourselves, our practices, and also that of our families. We all believe in excellence. We all believe in delivering the best healthcare at the best possible price in the best environment to our patients. And we want to make sure that our families have a place, our friends have a place, and our patients have a place that we think is as good as the place that we want to live in. Thank you very much for being here, and we look forward to this hospital.
And now we'll continue the very touching story of Mia as Dr. Bob Peters activates her cochlear implant for the very first time.
Not long ago at Forest Park Medical Center, Mia had surgery to help her hear. Now let's watch Mia hear for the very first time.
Well, today Mia is gonna get her cochlear implant, the activation, and she will start hearing. She will start hearing today, and we're very happy about it.
We were shaken and too excited for everything today. I know it wasn't like a huge thing, but for her it was something different.
Now the device is attached, and within a few moments you see responses from Mia that you've never seen. You know, you can tell something new is happening. She would have never been able to hear, and now she can and will. It's overwhelming. It's overwhelming.
She was happy, jumping and running, and it looked like she doesn't have anything there.
And we were so excited and so worried about her for not dropping the device. But she will do it, and we know. So we just want the best for her.
It has been a journey, and a long and a short one at the same time. Waiting, praying, wishing, and some days losing the hope.
It's an amazing journey, and now it's just begun.
It's going to take some time for her to start to process. It's all about the brain processing information. It's going to take her time to realize, oh, that was the door knock, that was the doorbell, that's mommy's phone, that's mommy's voice, that's daddy's voice. It's going to all take time, just like a normal hearing infant. A normal hearing infant is born hearing perfectly, but they don't understand. Maybe 6 months, maybe 8 months, they start to respond to their name. They might start to respond to the dog's name. So she has to go through the same developmental stages of hearing and learning to talk that a normal child goes through. And that takes months and years.
It's gonna be a real challenge for us, but we are going to practice and we are going to help her and teach her.
There is no way to say thank you enough. There's no way to repay it other than we will be your ambassador. I can tell you that, and we'll try to make the best out of it for Mia and watch her develop, and we're just so thankful.
Everyone is changing her life. It's a new beginning for her. It's like a newborn, but now she can really start to listen and changing that part in her life.
I had torn my ACL about in 2008, I believe, playing soccer. And it was something that I just kind of tried to rehab without having the surgery. I just was concerned about finding the right doctor to have it done. Honestly, I didn't have the time at the time to go through the rehab process. And what happened was I was in the backyard hanging a swing up for my daughter and jumped off the ladder because it started to move, and when I jumped, I hurt it again.
Well, most any sporting event that requires cutting puts you at risk of an ACL tear. Soccer, downhill skiing, football, basketball. It's a ligament that we can pretty much put back where it's supposed to be to try to allow you to return to that previous state of, or that previous level of activity.
I went to see Dr. Newton, and first visit, he said absolutely that my ACL was torn, and there was no reason at my age that I should leave it that way, that it wasn't a very difficult surgery.
It's an outpatient procedure this day and age, and the patient can walk even out of the hospital if they feel like it. Now, sometimes I will use crutches if they need them, but most of the time people don't need crutches even the day of surgery. I will use a CPM machine, which is a motion machine, to help them get their motion back, and an ice machine to help them with their pain. But the first 6 weeks usually is just letting them get their motion back. I do use a brace post-operatively. And then after that, after they've had some healing, then I start working more on strength and then endurance training, and then hopefully activity-related exercises to get them back to sport.
And the surgery went excellent, better than I could have imagined. I wish it's something I'd have done a lot earlier, because I played a lot of sports for many years wearing a knee brace, and I didn't really need to do that. I'm continuing to do a little bit of the physical therapy. Since we're towards the end of this now, I can't wait to be able to get back out and play sports and just throw the ball with my kids in the backyard and not be concerned about my knee hurting, slipping again.
Today's Ask the Doctor comes from Eric. Eric has a question for Dr. James Davidson. The question, how soon after bariatric surgery can I expect to see the diabetes go away?
People ask, how fast is their diabetes going to be improved with either a bypass or a sleeve? The answer is it's going to be improved faster with a bypass. And they may, if they don't have real severe diabetes, they may leave the hospital throwing away their metformin or their diabetic pills. With a sleeve, it may take longer. It may take a few months to both have a little weight loss and have a cumulative effects of the metabolic changes from a sleeve to resolve their diabetes. So my recommendation is if somebody wants to resolve their diabetes as fast as possible, you're probably better off to have a bypass.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Centers are one of the top medical center in all of the Dallas-Fort Worth area.
If you want more information on Forest Park Medical Center, the technology and the outstanding doctors that operate right here out of Forest Park Medical Center, you can find it on the website, bestdocsnetwork.com. Click on the Forest Park Medical Center tab.
And as always, if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.